He's 84-year-old and he has Parkinson's, dementia and weakness. And when I visited him, he was like this. You can see the video and you can see the symptoms. See? Everything is a symptom. Please be careful. See, she put some ointments because she, after seeing this is like a complicated case, because after seeing these things, she was taken to a general practitioner and she applied things and it was horrible pain and all the things. Then they started thinking, okay, we can go for homeopathy. So, this, the first day.
Okay.
See how it's coming down?
Unable to speak. Is dat een ziekte of komt het gewoon niet uit? Dat weet ik niet.
See how the things are peeling off. It's good? It's good? It's gone. It's gone. She's good now. And tell me the medicine. See, here the rashes are very less. But when you go for the children, small children, you can find a lot of rashes. She's like 20 or 24. 21. So, this happens whenever you are taking an antipyretic. So, if you got a fever and you got an antipyretic, the eruptions will suppress. What we call this exteriorization of the internal maladies. That's by Hahnemann, not by me. Exteriorization of the internal maladies are the eruptions in every acute diseases. If it is not coming out, that means the vitality is low.
Yeah.
In children and infants, the vitality is good. That's why they are having the eruptions more and they are having the less sufferings. This was the child, see. See the picture? See, the thing is, how could you able to tell, like, it's due to the vaccination. So if something happened just after the vaccination, on the next day onwards, or in a minute, or it's like, what happened during COVID, we got two medical doctors died suddenly after taking the vaccine. But a lot of people died after 2 or 3 days back, after 2 or 3 days, and it was not counted due to the vaccination. Because maybe meanwhile they would have taken something else. But we know that it's due to the vaccination, but they can't agree. But suddenly due to the vaccination, they don't have any other opinion. So the case went to the court in India. In this case, after DTP, the next day onwards, the symptoms started. So it's clear, we can take that, right? And moreover, in India, we are not having this much time for a patient. Because sometimes in 2 hours, I'll be looking 30 patients in 2 hours. Most probably acute cases will be there. Yeah, it's a mix. Sometimes acute, sometimes chronic, so we don't get the time. If I look a patient for 1 hour, my clinic, the front of my clinic will be full of patients. It's quite normal. It's not for me, but almost all the doctors are having the same scenario. Minimum, they are getting 25 to 30% patients a day, everyone.
Yeah, easily because of it used to be shyness, but also emotion. Because I can talk about it, but no.
See, it took almost 1 hour, more than 1 hour to make her relieve, you know. Now she is coming out. Huh?
Yeah.
So how do you felt in the beginning? How you felt that lady? She's strong, right? Yeah. Very strong, huh? Yeah, that's what we call the mask. You have to take off the mask. So now the mask is coming out. How we can enter the case? So this is what we call the cases which are having emotional disturbances on the one-sided diseases, you know. It's one-sided. Only the emotional plane is affected. So how to enter into this case? I already entered. That's why she cried. This is why the personality is, I said that personality is a mask. In the first instance, when you talk with her, you felt like she's very strong. She's talking very club, yeah. But after that, everything came down, right? That's the personality. You have to expose that. Yeah, you have to expose the personality. Otherwise, you will be giving the wrong medicines all the times. But in India, we don't get this much time. So what I'm doing is, it's a technique. I will ask the questions like dish. So I will get the answers, you know. Because I have to acquire tactics like that. Otherwise, I can't able to, survive. Because the patients are coming, even the chronic, even the acute. See, from the experience, when you're doing this for a long time, with experience, you know what to ask, not what to give. That's very important. If you have an experience of having prejudice of what to give, that is not good for homeopathy. But if you have experience and you have the knowledge what to ask, that's very important. Only for getting the rubrics, not the assumptions like when a patient is coming to you and he's telling something, you can put that into, oh, he's a metal, he's a mineral, he's a vegetable. No. How could you able to tell that he's a vegetable? Or how could you able to tell he's a mineral? Because in first instance, when you saw this lady, it seems to be a metal, right? She's strong. She's strong and she's doing all the things. And how could you able to do that? You have to expose them. You have to turn out the mask. For that, you need techniques. The techniques to get inside. And look at her words. She was telling like she doesn't want a partner. Okay, she was telling like that. She want a job. She want her to be a independent person. Don't make the things complicated. That's the important thing. You just have to pick up what is normal and when it becomes abnormal, and when the things derailed, it was normal, and when it becomes derailed, how the body reacted, how the individual reacted, that is the individual, that is the medicine.